ask you a question.
Sure.
When you have a federal grant and they decide they're no longer going to fund something, do they tell you why they've stopped the funding?
Well, this was what's called a competitive process, in which they have people come in and review the grants. But I always tell folks, since they pick who they want to come in and review the grants, I don't know how they call it objective review. But if you have an idea about who you think, and we got new people coming into Healthy Start this year, who it kind of reminds me of what we have with Congress, when you have Tea Party people running for Congress who don't like government.
Yeah.
Well, there's a whole lot of folks who don't like Healthy Start. And that's who's over it.
And that's who they bring in to give
That's who they bring in. That's who they have. That's who set up this 3.0, as they call it. And that's who. And this person's the one who brought in people who they wanted to do. So they did these levels before that they never did before. So, but what happened was, I was just explaining to James, was that they did the normal funding. I mean, did a number of guidance out, right? And they didn't get as many applicants as they thought. So then they did another one. Two things. They told us that we could apply for one, or we could apply for both of them if we wanted to. But it's clearly documented in the second one that they would not give these people who in round 2 until they reviewed and funded round 1. Which means, this is why I'm telling you I was shocked. Because I knew they didn't have enough, they had more than enough money. That's why they put on a round 2, right? So, and we already knew that we were approved. Because you would have gotten that back right away if we weren't approved. So, but what they did was, they got all these people who they saw, and I think, if not directly, indirectly, they went out and did a whole lot of recruiting. The way we talk about getting people to vote, they were very successful in getting people to come in and apply for that second round. And then they decided, we're going to put them all together. And that's what they did. Instead of still doing ours first the way they're supposed to, they put them all together.
So they put you on the same level as someone who hasn't been doing anything.
Yeah.
I mean, and locked them.
Yeah.
I mean,
and plus, we only applied. I told you they did these levels. We only applied for level 1, which it was $150,000 hit for us. Level 1 was just doing what we were already doing, but they had a level 2 that you did more community-wide things. And to be honest, guys, y'all know I stay in trouble here in Milwaukee, right?
Right.
So I knew it might not be easy for me to. This way, the people who needed support us didn't have to pick or whatever. So we didn't go. We said we'll just go for doing what we already do, and and then 3 was supposed to be this collective impact, and they wanted regional. So I'm still thinking, well, okay, so we're just going to do this. But then when we got the information, come to find out that they funded more of 2 and 3 than they said they would, and less of 1.
And that just seems
that
kind
just cut us
of backwards. I mean,
well, yeah. If you ask about it, like you said, in terms of who, level 1 was really for folks who really knew how to do Healthy Start. But if you don't, but if you have a problem with it, it's not evidence-based, as they say. But evidence. All you have to do, people, is go do some kind of research project for a few years, write it up in a magazine, and they say that's evidence. And that's evidence, but it's not all the evidence.
Right.
Like I said, with ours, as a matter of fact, ours is actually getting ready to be published in a magazine, which is so crazy about this, that talks about, and what it basically says is the point you made is that, it's showing that the type of holistic targeted case management that we do, that our babies, the babies that grow, are, that they weigh more. So we don't have low birth weight babies. We don't have many babies die. It shows that we have babies that are doing well and we get, unlike some of these other programs that are even in the city, we don't pick and choose who we take. We take whoever comes through our door, whoever refers us. So a 14-year-old year ago comes through the door, she's due in 2 weeks. Most of these other case management programs wouldn't even take her. We'll take something like that. We're in the jail. We've been in the jail since 2000. So we get a lot of women out of our jails, out of domestic violence situations, from shelters or wherever they are, and we're able to show that we have better birth outcomes, which means we figured this out.
Well, then what is the government going to do now that they've taken your funds and all these things that you all have been doing? What's going to happen to all these people?
Well, their thing is, we're going to give you time to refer your people to other places.
But
they don't understand that what we do, nobody else does.
One of the things that I noticed
so that's a problem for us.
One of the things that I noticed about this community, there are certain individuals who run agencies that get money, who know people, that kind of situation. And I've noticed that it winds up that these grants wind up going to some of these people.
That's right.
And so then the question comes down to these people who really don't know our community, but they can do some research, some work, and some numbers and things
PR
like that.
stuff,
Yeah,
yeah.
that make and they
right.
make these things work.
I mean, I call it really it's always been frustrating me in Milwaukee because unlike maybe some of the cities that have the problems we have resources, but this is a plantation. You got good meaning people who think that we don't do something, but they have a problem with giving it to black organizations.
And
May I ask
go
Dr.
right
McManus
ahead.
a question? Is there an appeal process or a process to request reconsideration in the regulations?
Yes, but the way they did it, unless you appeal the process rather than what our score was. You see, they tell, because folks have already called them already, they said, well, you know, they scored, like we scored an 80, but we still were approved. I said, I don't care if we scored a 60. We were approved.
Yes.
And your guideline says if you're approved and funds are available, we will fund you. So that becomes, so we're trying to get that aspect out there. And oddly enough, so there's no Healthy Start site in Wisconsin. The one in Arkansas didn't get funded. St. Louis didn't get
The
funded.
places that really didn't.
Yeah, I'm talking to the people, Grand Rapids, Michigan. I was talking to the woman in St. Louis because she's like, well, you know, with Ferguson and everything, they've been dealing with all, she said, because when she describes it, it's so similar to Milwaukee, it's scary in St. Louis to what they have. So we actually are trying to work with other ones that did not get funded and working with our, Gwen, she had jumped on it right away. And Shirley's working really hard and Tammy Baldwin's office is working hard. We're going to have to help
Is there
Ron
something that our
Johnson help us,
community-
but
is
we're going to get him to help us.
Is there a number or something? Is there something like the people in the community could call a number, federal government or something, or on behalf of the Black Health Coalition?
Well, we could, because we could have them call, especially call, because I think that would be important for folks to call. We will give you, I don't have that number with me, but I'll get it back to you, because they need to hear
And
from the community. They need to hear from the community people.
What about if we send petitions or something?
We can send
We can
everything.
get that,
We're talking about sending this stuff, but the question then is, how connected are the people of color who are not directly impacted by the things that the programs and services you offer? How connected are they to this need that they can do this? Because the people who use and need the services are not typically the ones that are writing letters and calling politicians.
May I just say, I said to Pat that the NAACP state conference over the weekend adopted a resolution to fully support.
Which was wonderful. I didn't know they were doing that.
So NAACP, not just the Milwaukee branch, but the entire state conference will be doing just what Dr. McManus is speaking of in terms of advocating, supporting, and we want to, find out the most effective way to do it.
And what Deborah's talking about, one of the things that we do very uniquely, Deborah, is that, one of the things we do that others don't do is advocacy. We do but we also teach people how to advocate for themselves.
Yes.
So we do have an African American Mortality task force, and we're just what you're talking about. We're going to ask them, because these are folks that we have helped, that we help every day, and not to mention our HIV project and everything else, to help us that they can call or write letters or do everything. We wanted to get some of the other stuff that when Moore's working on and Tammy Baldwin in place first, to get that in there. But yes, absolutely. And I mean, I wanted my staff, very hard conversation with them, and most of them actually agreed to even help volunteer to keep us going.
As long as they can, because
they got to get it right.
Yes, because they got families and they
Exactly.
have expenses and
Yeah,
stuff.
but not volunteer full time, but if they're doing something else.
You
But
provide
I just think
services.
that's wonderful.
And
For
great
people
it is.
of non-colored, for white folks.
We
and
serve everybody.
Okay,
Yes.
and so the thing is,
absolutely.
why is it that whenever it's African Americans that are doing something, have a problem, we come to, okay, we've got a solution, we're working at it, then we want to remove that as if it's only African Americans that have these unique problems.
Oh no, we work with everybody. We work well in terms of helping people. We work well with our dads, which is unusual too, because we say you don't have to be together, but you got to work for this child.
Right.
So we have a fatherhood program that works with dads whether they do or not. But yes, I mean, folks do think. I mean, with our, we're one of the navigator entities for the ACA, and we had people calling you know, 300 miles away because they didn't have navigators up there, and they didn't realize when they were calling, because we're listed as the National Healthy Start Association, but when they called, it says Black Health Coalition, you know, my staff would say a couple people, there'd be a pause, and they would hang back up. But then one lady, she just finally said, well, do you help white people too?
Oh, wow.
And we told her absolutely, and she became one of our biggest recruiters. She's a fan, you know, she really would have other people call. So it is unfortunate that it's that way, that people just think. I mean, if you go into a white organization, they expect that you're going to serve everybody.
Yes,
When you come to a black organization, they think you're only going to serve black people, which isn't true.
But then again, the need is the greatest too in people of color.
That's right.
You know,
that's
with
right.
all of the system and things that's the barricades and the bumps in the road that people of color have to deal with, that white folks don't even have that.
Right. And even something as
that,
simple as an assessment. I'm turning something simple as an assessment. The eyes that assess are very different depending on what culture you come from.
Yeah,
Whether you like it or not, you find something that's a problem that we're looking like, that's not a problem. You know, but that's what they think based on what was written.
And the fact that you said that they're going to give you time, you all got to place your clients with some other agency, which a lot of them probably
not gonna go.
And it just seems like whenever we find a system or something that works, that benefits and help people of color or people on the bottom, it just seems like, and I hear Sherman talk about it on his show every morning. There's some element out there that don't want to see people of color succeed. And if anything, if it looks like what you're doing, you're getting those babies early on, and you're going to give them a healthy start. Well, there's some out there that don't want that.
Yes.
They don't want. They want the people to end up with
the babies
Attorney Hall
gone.
was talking about in the prisons.
Well, wait now, Polly, because now I remember when the mayor and Bevan Baker came out and they talked about we were able to reduce teen pregnancy, which the way the media always portrays it, it's just our kids that are getting pregnant. So it was only black girls that were getting pregnant. But they came out and they said, oh, we're reducing teen pregnancy. We're doing why wasn't there the kudos and the shout outs, and why wasn't there all this big production about the work that you do in terms of infant mortality? Because everybody wants to be on the news to talk about how great the good stuff is.
Exactly. And I used to say that even before in infant mortality, you know, you have to look at averages, rolling averages, and you know, sometimes it goes down a little bit, then there's a press conference. When it goes back up, there's no press. I said this to John Norquist's staff once, you know, because they invited me to come to the conference, the press conference, and I said, what am I supposed to say? You know, I told him, I said, you need to tell him that I'm not going to be out there saying that things are great. And but when we got there, he came to me and said, John said, Pat, I understand we're not real happy about this. I said, you're right. Encouraged, but not real happy. You know, but both Bevan and the mayor have been very supportive of me in this.
Okay, we have a break coming up again. You're listening to WNOV.